I will move adoption again. Thank you, Mr. Speaker.
Thank you. Questions on adoption of House A. The distinguished ranking member of the Public Health Committee, Representative Srinivasan.
Good evening, Mr. Speaker.
Good evening, sir.
Mr. Speaker, we have before us a bill that is going to have an impact, a significant impact on the landscape of health care for our state. As we all are aware of, in the fall and into the early winter, the roundtable discussions that we had brought to us, to the Public Health Committee, a string of bills, individual bills, which then the Senate had decided put it all together in one big bill, Senate Bill 811, and that is the bill that we are discussing and debating this evening. This bill has evolved significantly. As I look at the distance from the Senate chambers to the House chambers, is not a long distance between the two chambers. But if you look at what this bill has done from coming up to here, it has traveled significantly in multiple ways. And that is what we are here tonight to debate and discuss. What has happened to 811, which came down to us, as a good chairman said, around Memorial Day. And here we are in the late hours of a Saturday night discussing and debating Senate Bill 811. Its impact on our consumers, its impact on the providers, and of course, the impact it will have on our hospitals. That is Senate Bill 811. I want to thank the good chairman for being always available, for always listening to our concerns. He's always included me in every discussion and every debate. And in a true bipartisan way, with a continuous ongoing conversation till the late hours of this evening, we have changed Senate Bill 811 from where it was to where it is today. This side of the aisle, you are well aware of my thoughts and my comments earlier on. I have come around a good 190 degrees, not 100, 90 degrees on where I was before, close to maybe 100, from where I stood not too long ago. And the reason is we have been able to incorporate quite a lot in this bill. As we discuss and debate this bill, and of course we will have this opportunity this evening, the segments of consumer protection, of being helpful to a consumer, is definitely there, an add-on to what we already have. In terms of providers, healthcare providers, primary care providers, specialty providers, ambulatory care centers, their concerns have all been addressed. And if you look at the hospital's primary concern is the budget, what is the impact the budget is going to have on them, what are their taxes, what is going to be the reimbursement, the Medicaid reimbursement. That is of significant importance to the hospital. And as I'm sure you're well aware of, this bill does not address those issues. That debate is for another day, not tonight, but sometime, I'm sure, coming up early next week. So when we look at this bill, 811, as amended, we are looking at quite a few changes that we saw from day one. And that is what we need to be addressing. And as I said earlier on, this has been bipartisan effort to get to various areas that are of concern to all of us. And together, I think, the good chairman, including us in our conversations all along the way, I firmly believe that we have a good product, a better product in front of us. Something that we can be happy with, something we can be proud of. Is it perfect? As the good chairman said, of course not. But something we can definitely live with because it has a lot of good values to this bill. With that, Mr. Speaker, I would like a few questions to the good chairman of the Public Health Committee.
Proceed, sir.
Thank you, Mr. Speaker. Mr. Speaker, will this bill require the healthcare carriers, the healthcare providers, to, on an ongoing basis, submit to the exchange the various components of healthcare in terms of services rendered to the healthcare exchange? Through you, Mr. Speaker.
Representative Ritter.
Thank you, Mr. Speaker. And through you, the health carriers, yes. The bill requires, effective January 1, 2017, for them to submit various information. Through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, has that effective date been pushed back to 2017 from where it was? Through you, Mr. Speaker.
Representative Ritter.
Yes, through Mr. Speaker, that was pushed back. The effort really is there was some questions about what could be submitted, how quickly. And again, we're trying to get a great end product. We're also not trying to rush it. And so we have time and to look at it next year a little bit and let them prepare and see what we come back with. And that's why it was pushed back in a compromise to you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, in this bill, how many of the various most frequent hospital inpatient procedures will have to be reported to the healthcare exchange? Through you, Mr. Speaker.
Representative Ritter.
Mr. Speaker, the answer is 50.
Representative Srinivasan.
Through you, Mr. Speaker, is that 50 for January 27, or is that on a sliding scale and that 50 will increase to 100? Through you, Mr. Speaker.
Representative Ritter.
Yeah, it's 50.
It's being helpful on his mic there. Through Mr. Speaker. We had different iterations, so sometimes you're kind of remembering the version. It was at 100 in one earlier version. It will just be 50 going forward, through Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, coming to sections 2 and 3, which are notices to patients. Through you, Mr. Speaker, will the licensed healthcare provider need to provide the insured patients information about the insurance coverage to each and every one of them? Through you, Mr. Speaker.
Representative Ritter.
Mr. Speaker, just to clarify, the question was the healthcare providers or the hospitals? Through you.
Representative Srinivasan.
Through you, Mr. Speaker, licensed healthcare providers. Through you, Mr. Speaker.
Representative Ritter.
Thoughts is what he said. I believe in Section 3, the change is just that the hospitals will make this available. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, and to whom does the hospital make it available? To everyone or only on request? Through you, Mr. Speaker.
Representative Ritter.
Yes, to Mr. Speaker, it's upon request of the information from the patient. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, on a non-emergency diagnosis, when this information is requested, who comes up with the outline of what this request should comprise of? What are the various details of which need to be addressed to the person who's requesting that information? Through you, Mr. Speaker.
Representative Ritter.
Through you, Mr. Speaker, there's a host of things required. Some of it includes the Medicare reimbursement amount. Some of it might be for uninsured patients, the amount to be charged. If all the charges are paid in full without a third party paying any portion. It talks about including facility fees if they're applicable. There's a whole list of theirs. Those are sort of a summary. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, this whole list that will have to be addressed when requested, who has the charge, through you, Mr. Speaker, to come up with that list? Through you, Mr. Speaker.
Representative Ritter.
Mr. Speaker, I think the question is that there will be some DPH and the insurance commissioner will report on some of the stuff described as we earlier talked about. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, there's been a lot of discussion on surprise billing, on unfair billing practices. Through you, Mr. Speaker, does the bill require prior authorization for emergency services. Through you, Mr. Speaker.
Representative Ritter.
It does not, through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, in an emergency situation where prior authorization is not needed, does it make a difference if it is in-network or if it is out-of-network? Through you, Mr. Speaker.
Representative Ritter.
Mr. Speaker, I think to get to the point of the question, if you have a surprise bill, which a few weeks ago I will admit we sort of joked, we had a tough time kind of understanding this concept. This has been one of the tougher sections. So a surprise bill is essentially, you're in an emergency. Let me just try to explain it, because you're in an emergency room, you're about to get a procedure, and they bring in an out-of-network doctor in to treat you. Well, you're about to get treated for an emergency, so you're not going to be able to consent to paying this higher fee. So what we've done is we've held the consumer, the patient, harmless, and then that gets worked out after that between the insurance carrier and the healthcare provider. There were stories, the New York Times did an expose on this a little bit, of patients getting hit with like $15,000 bills. Surprise, that's where the name comes from. It's a bad surprise, and we tried to make that better. It's a very consumer-friendly provision, Mr. Speaker. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, I want to thank the good chair for the explanation for the surprise billing. But so that we are all clear here, in this surprise billing, in an emergency situation, who then decides what the reimbursement to the non-network provider is? Through you, Mr. Speaker.
Representative Ritter.
Thank you, Mr. Speaker. There's a listing in the statute which sort of models the Affordable Care Act, which lists different things. It would be the greatest of 3 different amounts, but it also lets them negotiate a different amount. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, that various amounts and the negotiated amounts, is there an arbitration process if there is a dispute? Through you, Mr. Speaker.
Representative Ritter.
No, Mr. Speaker. Through, if they couldn't agree, then they'd go back to the greatest amount of the 3 listed, which sort of mirrors the Affordable Care Act. Through you.
Representative Srinivasan.
Thank you, Mr. Speaker. That definitely takes away the surprise element, which is a good thing, which is the whole purpose of the bill, is to take away for the consumer that the surprise component is not there, and it'll be resolved between the provider and the insurer, depending on what the 3 various categories are. Through you, Mr. Speaker, if we can now move to facility fees. Would the good chairman explain to us where we are on facility fees as we move forward with this legislation?
Representative Ritter.
Yes, thank you, Mr. Speaker. Through you. The facility fee language has changed a lot from committee. There was caps in the original version. We didn't get a lot of conversation on facility fee on the bill. A lot of it went to notice provisions. Many of you remember last year this sort of exploded. There was a lot of legislation, I think, proposed to address this. And the issue is really we want notice for consumers. There are some restrictions on when a facility fee can be charged, but by and large, they want people to notify a patient about facility fees going forward. That's really the aim of the goal of the bill. Through you.
Representative Srinivasan.
So through you, Mr. Speaker, what we're trying to do in this legislation is informing the patient that they will be getting a facility fee. Through you, Mr. Speaker.
Representative Ritter.
That's correct. And then, as we get later in the bill on 1/1/17, there are restrictions based on, again, you learn a lot in some of the committees you work on. There's something called an evaluation and management code. And so for what we would consider, I don't want to say primary care service, that's not entirely accurate, but more routine checkups, you'd be prohibited from charging facility fees. That's a recommendation from the federal government that's been there for some years. Through you.
Representative Srinivasan.
So through you, Mr. Speaker, we are right now in May heading to June. So the facility fees from now through January, the whatever facility fees are being charged will continue to be charged. The only difference is that the consumer will be made aware that the billing will comprise of a facility fee as well. Through you, Mr. Speaker.
Representative Ritter.
Yes, but I just want to clarify the dates. January 1/16 is the notice. There was a request that it would take some time to ramp that up, so there was a delay to that. That was, again, something that was talked about. And then the prohibitions, January 1/17. Again, it's a lot. It's thick. So we realize that effective dates are really meaningful and powerful, and there needs a ramp-up time, and that was part of the deliberation. Through you.
Representative Srinivasan.
And so through you, Mr. Speaker, on this facility fee, before we move on, from January 1, 17, so which we've got almost a year and a half at this point, and we have an opportunity in 16 to come back here and make any changes if need be, which is a wonderful thing. That opportunity is there. So that is when this prohibition or limitation where a facility fee can be charged will go into effect. Through you, Mr. Speaker.
Representative Ritter.
That is correct. And through you, Mr. Speaker, if we didn't make mistakes, what purpose would we have to come back next year? Through you.
A philosophical question. Representative Srinivasan.
Through you, Mr. Speaker, as we speak in this legislation, of course, there's always a possibility of change. But in this legislation, the only situation where a facility fee cannot be charged as per the federal code would be for the outpatient-based office visits, evaluation, and treatment, what we normally refer to as a routine office visit. Through you, Mr. Speaker.
Representative Ritter.
That's correct. And in the conversations, there was a thought that there may be some appropriate times when you would have to charge a facility fee in certain situations, particularly more specialty type care, and that was the give and take of the negotiation. Through you.
Representative Srinivasan.
Through you, Mr. Speaker, two other sections that I will be addressing, and then my colleagues on my side of the aisle probably be discussing other sections of this bill so that we are not all redundant on the entire bill. Through you, Mr. Speaker, could the good chairman tell us what is the status in this bill, if any, of tiered networks? Through you, Mr. Speaker.
Representative Ritter.
Mr. Speaker, another change from the original bill. The tiered network provision was essentially in the strike all taken out. However, the exchange may allow tiered networks through the exchange process. That language is still in there. And I believe it may be getting studied in one version of this or not. Through you, Mr. Speaker.
Representative Srinivasan.
So through you, Mr. Speaker, there may be a study or it may be alluded to, but we are not mandating the insurers that they do need to provide this alternative to the consumer. Through you, Mr. Speaker.
Representative Ritter.
That is correct, Mr. Speaker. Through you, we're not requiring that.
Representative Srinivasan.
And through you, Mr. Speaker, would the good chairman comment about site neutrality? That also was a very tricky component of the bill that came down to us. A lot of discussion about the reimbursement rates in place A, in place B. And to make it neutral, that is what site neutrality is all about. It does not matter. The site is neutral. Through you, Mr. Speaker, where are we on this bill on site neutrality? Through you, Mr. Speaker.
Representative Ritter.
Through you, Mr. Speaker, we started the day with a bit of a prank related to studies and task forces. We'll end the night on that. The site neutral payment, section 21 in your emails that was alluded to, was removed from the bill and replaced with a study of it. Through you, Mr. Speaker.
Representative Srinivasan.
Through you, Mr. Speaker, I want to thank the good chair for all the effort that he's put in. He definitely has taken his task very seriously. I know his background is not in medicine, but you could be surprised at the depth of information he has. And more than the information, the fact that he is always willing to learn and to work in a bipartisan way is definitely something that I've cherished and something that I look forward to in the years to come. And through you, Mr. Speaker, I want to thank you for giving me this opportunity to discuss this issue on the floor of the House. Thank you, Mr. Speaker.
Thank you, sir. Representative